Good evening. I'm Gracelyn Guyol, and welcome to Restoring Health Holistically. This evening's guest is Bonnie Tetro. Welcome, Bonnie.
Thank you.
Bonnie is a licensed massage therapist, and she's the owner of Longevity Wellness. She also is a specialist in lymphatic drainage, which will explain what that means as we get into the program. She had a Florida licensed massage and colon hydrotherapy license since 1988 in Florida, and she's a Connecticut licensed massage therapist since 1992. In 1995, she began studying lymphatic drainage and became a certified Botter manual and electrolymphatic drainage therapist, as well as a decongestive physiotherapy practitioner. She's a member of the International Association of Colon Hydrotherapists and the Associated Bodywork and Massage Professionals. Bonnie worked with several Connecticut physicians and physical therapy groups before opening her current private practice in Lebanon, Connecticut in 1995. In 2006, I was organizing a series of seminars on healing without drugs and invited Bonnie to speak. Her knowledge and experience about how to maintain the crucial lymphatic systems that we all need was so impressive. She is the first practitioner I call whenever I feel my immune system needs a tune-up. So for those who don't know what lymphatic drainage is, tell us what the lymphatic system is and what it does, please.
Okay. The lymphatic system is the cleansing system of every cell in our body. We have 70 trillion cells, and we also are floating in this ocean of lymphatic or tissue fluid, and every cell in your body is being washed clean from the toxic debris that builds up around every cell in our body.
And so it's not just toxins from the outside, but it's also debris that gets accumulated from cellular processing, right?
Oh, yeah.
Yeah.
We have toxins, like you say, from cellular debris, from metabolic waste. Even now, in today's vernacular, the environmental toxins are really sabotaging our health.
Okay.
And then also we have the cells that die every day.
Mm-hmm. In the natural cleansing of the body. So how large is this system? And we're getting some sense of why it's important, but expand on that. So how vast is this?
Well, every single cell in your body that has blood supply has lymphatic drainage, because that's the only way the toxic debris is going to get out of the body, is through the lymph vessels. The blood capillaries are too small. The thickness of a blood vessel is equivalent to 10 human hairs. So we are talking at a molecular and microscopic size when we're talking about cleansing and detoxing at a cellular level.
Okay. So, what about the lymph vessels? And
okay, so as the lymph fluid is washing all of this toxic debris loose, the lymph vessels then pick up and transport. Your lymph vessels is like your highway system to get all this toxic debris away from the tissue, and then transporting it to our lymph nodes. We have 700 lymph nodes in the body, and the lymph nodes are abundant in the white blood cells, and that's where the viruses, bacterias, parasites, microbial pathogens, all that gets picked up. That's part of the lymph obligatory load as well, is to get that out of the body. But then we have selective white blood cells, the macrophages, that are Pac-Man. They gobble, chum, 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 and chew that up to bring it down to a smaller size.
That can flow through these lymph vessels?
No.
Okay.
No. So the lymph vessels transport it to the lymph nodes, and the lymph nodes kill, destroy, break down to a smaller size. So now the small little blood vessel, remember, the thickness of 10 human hairs, that now can pick it up and transport it out to our organs of detoxification and elimination. That's the liver, the kidneys, the colon, the lungs, and the largest organ of elimination is the skin.
The skin itself.
Yeah.
Okay. So we've talked a little bit about what the waste consists of. So how has we know that the exterior toxins have increased a great deal since World War II because there's so much, our air is polluted, our water is polluted, our food chain is polluted. So these systems are really struggling with this buildup. So I'll let you talk a little bit about what this means in the toxic and lymphatic overload.
Okay. So, prior to the Industrial Revolution, our lymphatic system was able to handle the toxic waste that was coming from just maybe epidemics of infectious diseases or poor sanitation issues, and then with the Industrial Revolution, we introduced a lot more toxins. So now, not only do we deal with the poisons from within, we are dealing with the poisons in the environment that get into the body. So, and as an example, lead can be stored in our bones 500 to 700 times more than in the bones of our ancestors. And we still have DDT stored in our fatty tissues.
And it's been outlawed for 30 years?
Yep. And the thing is with the fats that must be picked up with the lymphatics, all fats must be picked up by the lymphatic system. But fat cells will store toxic waste and acidic waste, because if the body gets on toxic overload and it can't get out through the normal process of lymphatic drainage, the body is going to stuff it into fat cells.
To just keep it safe. Keep the body safe. So it puts it in storage to just get it out of the flow.
Yeah.
Okay.
But there's also 800,000 petrochemicals dumped in our environment annually. And since 1993, 1,600,000,000 plus pounds of toxic chemicals have been released into our environment. So we have outgassing from carpets, paints, fabrics, and plastics. And so we live and work in sick buildings. So the lymphatic system of today is really under an attack.
Challenge.
Yes.
Well, I know that after hearing your talk, I would come to you because at that time I knew nothing about the lymphatic system, but when you did that lecture for my seminar, it made me aware that I needed to have lymphatic drainage done on a fairly, like a maintenance basis in order to help my body throw off all of this stuff. So what effect do the chemical additives in foods, genetically modified organisms, and these other synthetic, what I call frankenfoods, have to do with this too?
Okay. So there's 1.3 billion pounds of pesticides and herbicides sprayed on our food supply annually and get stored in our fatty tissues. Remember I said fat cells will absorb toxins? DDT gets stored in our fat cells. And what causes our chemicals to be toxic is because they are non-biodegradable. We can't break them down. We do not have the enzymes to break down these.
The body does not have.
The body
Yes,
does
yeah,
not have
yeah.
these enzymes to break down these chemicals, and that's what non-biodegradable means. The
Okay.
body just can't break it down.
Okay, so
Now,
what do you do? No. Okay, so
and then when it comes to what you said referred to as the frankenfoods, you know, there's 3,000 different chemical food additives in our food today, and I don't know if you're aware of some of these are even petrochemicals, like for example the propylene glycol. Why would they put something like that in our food? But it's there.
it's because the Food and Drug Administration had drug industry and big pharmaceutical food industry executives at the top running the Food and Drug Administration that's supposed to protect we citizens from all of this, but they actually protect industry instead. And so that's been going on for about 2-3 decades, and it still is in place, and the Food and Drug Administration is not a friend of those of us who wish to be healthy. They're protecting those of the polluters, and they're international polluters, unfortunately. So until that changes, it's everybody's on their own. But also, there's another problem is the stress of daily living that's adding to the challenge that the body faces. So
Right.
talk about that.
Okay. Well, you know, junk foods and processed foods will alter our normal alkaline pH, even if we're trying to eat a healthy diet. We just won't digest properly when we're under stress. So just like with junk foods and processed foods, stress alters our pH and makes it more acidic. And the important thing about the acidity is that there again, we will not properly even metabolize normally. And this is more toxins that will actually get stuffed into fat cells if the lymphatic system can't handle it all.
Okay. So I think we've convinced everybody out there that we're living in a toxic soup, and the body is not, it's equipped to handle toxins, but not the level that it's being dished these days. So what indicates what symptoms do we have that this lymph system is struggling? How would we know?
Okay. There are, like for example, when a person is experiencing a lot of catarrh or phlegm, this is a red flag that our cell membranes are inflamed. Phlegm is from inflammation in the respiratory system. Catarrh is from the the mucous membranes in the openings from the inside of the body to the outside of the body, the nose, the ears, the throat, the whole gastrointestinal tract. And the mucous membrane is our first line of defense. It is abundant in white blood cells, airborne, waterborne, any kind of herbicides or additives that are on our food that we take in when we are, digesting our food. So today, this mucous membrane can build up this plaque, and because the normal mucous membrane will replace itself every 3 to 5 days. So this is where this catarrh or this buildup of this excess mucus plaque comes from. And that's probably one of the most common symptoms.
Okay.
But then when we have water retention, you know, the tissue is soft and spongy because there's just more water building up in the tissue. And
because it's not able to drain off through the lymphatic system, so it builds up. Is that what you're saying?
yes.
Okay.
Yeah.
Okay. So people who have edema or swelling, they, you know, because the water is building up in their body, what most of them do is take a diuretic to pull that out. But that that's getting rid of the excess fluid, but it's not necessarily cleansing.
Correct.
Okay.
And then there's another issue with the diuretics is that the blood plasma proteins that seep out from the blood vessel, 50% of our blood proteins seep out every day, okay? Now, they can attract and hold water. And then when you do diuretics, you're taking out the water, but then you are concentrating the blood proteins that have seeped out of the small little blood vessel. And these blood proteins must be picked up for survival. We would die within 24 hours if those blood proteins were not picked up. That's one of the main functions of the lymphatic system. So,
Okay.
you know, diuretics have a therapeutic application in certain issues with different edemas, but then there are other things that we can do. For example, whey. Whey is
Whey protein?
Yeah.
Okay.
It's a natural diuretic for the body, plus it is alkaline. If a person's lactose intolerant, they can't tolerate it. But you know, other alternatives to taking too many water pills because you don't, or diuretics, because you don't want the solid debris to clump up, and
to be left behind because there's not enough fluid to dilute it.
That's right.
Okay, okay. So, so edema is another symptom of a stagnant or a blocked lymphatic drainage system.
Yeah, sluggish.
Sluggish, all right. And
And,
so talk about the skin, how
Well,
that's...
since the skin is the largest organ of elimination, 70% of our toxins can come out through our skin.
I didn't
That's
know
pretty
that.
amazing.
That is
Yeah.
amazing.
So when we have redness and we have, you know, pimples or other signs of
Dry
you know,
skin.
dry skin, cellulite blemishes, this is showing that the lymphatic system is on overload, and it's trying to push so many toxins out through the skin, and this is just a good indication that we need to detox the body. And
I just want to insert another little thought here because in the winter and in the older population of which I have joined, people don't drink enough fluids. So you can have a stagnant lymphatic system, I presume, if you are dehydrated.
absolutely.
And dehydration is really common in the wintertime. You're not outside, you don't think, oh, I've got to drink fluids, and you're less physically active. And so I find that my skin, I have more problems with my skin in the winter than I do in the summer, I think because of just not being aware of needing to stay hydrated. Okay, so other symptoms are arthritis?
Any joint pain, arthritic issues, inflexibility,
Stiffness.
soreness. This is indicative of inflammation. And inflammation is another red flag that the lymphatic system is on overload.
See, I don't, you know, we all think of arthritis and inflammation as just a natural occurrence of aging, and that's not necessarily so.
Right.
So, all right. You'd mentioned that stomach pain and nausea can be an indicator?
Oh, yeah, because, you know, a large portion of the gastrointestinal tract is part of the lymphatic system and part of the immune system. You know, the immune system and the lymphatic system work together. And for example, we have specialized lymph vessels in the intestinal tract, our lacteals. They are there to absorb our dietary fats. All fats in our diet go through the lymphatic system first.
Oh, that's interesting.
And and then with all of, like you were referring to the Franken foods and the genetically modified foods, if I can mention one.
Absolutely.
And that's the soy. All soy in this country is genetically modified. And what genetically modified means is that they are trying to create a plant that is more resistant to
diseases or pests or whatever.
Yeah. And so what they will do is they will actually create an anti-parasitic gene and insert it into the gene of the soy.
Right.
So they take a gene from a bacteria and a virus, and then from the petunia plant. Why the petunia plant? I don't know. But the thing is, this natural insecticide to have more of a harvest yield, because the whole process of genetically modified is we are going to save the world from starvation by having more of a harvest yield. And they're doing this by altering the DNA by the plant.
Yeah. And the problem is that they're often inserting things in the genes into plants that are from a shellfish or from a petunia plant or from God knows what. And so if you happen to eat that food and you're allergic to a petunia plant, you don't know that you're ingesting part of that. And so it's like opening Pandora's box, because they're not required to let us consumers know what genes are in there. And so that could be what's contributing to all of the allergies that children are having today, is this genetically modified foods that, again, is not regulated by the FDA properly, and there's a big fight in the States to get it outlawed or to even let us know what's genetically modified. So this is, once again, how we are overloading, and because of poor regulation and government oversight and lack of legislative will in this country to protect consumers, they're really only giving the power to all of the big pharmaceutical companies in terms of drugs, and also the big agribusiness companies, and it's all about profits, and it has nothing to do with our health.
Yeah.
So that speech put aside.
Yeah, but what happens with when you eat genetically modified food is that this gene now can invade our good bacteria that is abundant in the intestinal tract. So when you ask about, well, the nausea, the gas, the stomach pains, and when England allowed our soy to come into their country with, I think it was with 6 months, food allergies was up 50%.
That's amazing.
And you know, a lot of countries will not accept our food because it's not
and I
labeled.
wouldn't either if we had a choice.
Yeah.
The only choice we have is organic, but
it does
okay.
it does cause, you know, nausea and gas, and
so a lot of the illnesses that are skyrocketing in this country is because of this lack of proper oversight of food and drugs that we are consuming without knowing what we're getting.
yeah.
So let's talk about what your treatment, your therapy, your approach of lymphatic drainage, how this can help our overloaded systems to handle this and offload some of these toxins.
Well, As much work as the lymphatic system does, it is a very slow, sluggish system. We have 6 to 10 liters of lymph fluid in our body, but only 2 to 3 liters are circulated on a daily basis, going through the whole cleansing process. A blood vessel has a pulse rate of 60 to 100 per minute. The contractions of a lymph vessel are about 5 to 8 per minute. So it moves very slowly.
Okay.
And this is, and so then when there are more toxins and poisons coming in and trying to be dealt with, then the body can process. You know, then we get this backup, we get this toxic overload. And this is where lymphatic drainage therapy can be very, very effective. Dr. Jack Shields is a lymphologist, and in one of his books, he states that lymph flow is increased 10 to 30 times with just deep abdominal breathing, yoga breathing, because that diaphragm will act like a pump to move that lymph fluid and getting it recirculated.
Okay.
And then also with exercise, we can increase the flow 10 to 30 fold with exercise.
Well, I know that exercise is really great for detoxification, but I really didn't connect it to the lymphatic system.
Oh, yeah.
But physical activity keeps that pump going
Well,
faster.
there are no pumps and valves in the lymph vessels.
Okay.
So it's dependent on breathing and pulsation of our arteries and the movement of our skeletal muscles to get that lymphatic the lymph vessels moving. And
So
go ahead.
That's why exercise is so crucial
Yeah.
to help. Daily exercise, because the body was evolved to working and being physically active, and now we have such a sedentary population. But this is part of why is the immune system becomes less effective if we don't move.
That's right.
Okay.
Yeah, you're
All
right.
Okay.
Yeah, because our work used to be our exercise. We didn't have vacuum cleaners. We had to take the rugs and beat them on the clothesline.
Right.
We huffed and puffed from morning to night. And
now we sit and watch TV and push a button.
but with lymphatic drainage therapy, that lymph flow can be increased up to 45 to 55 liters in a day. So that's pretty significant. So it's not that we have more lymph fluid in the body. We still have the 6 to 10 liters, but it's more rapidly circulating through the whole cleansing system, and everything's getting squeaky clean.
Well, it's like putting your washing machine on fast rather than having it be on a slow pulse.
Yeah.
Okay. So lymphatic is related to inflammation, and so the lymphatic drainage helps to relieve inflammation. So talk about inflammation's response to tissue damage, and this is number 10.
Oh.
Okay. What the lymphatic drainage, how it impacts inflammation.
Okay. Well, when it comes to the inflammation in response to tissue damage and toxic waste, any redness, any swelling, any heat or pain, and then also loss of function will indicate that there is inflammation in the tissues. And there again, Dr. Jack Shields has stated that when you increase exercise, you bring oxygen delivery to the tissues. And it's the oxygen that gets to the tissues that can also help and assist with inflammation. Fibromyalgia, fibrocystic breast, allergies, all of these things will indicate that there's inflammation. And so the major benefits of lymphatic drainage are when you detox the body, it reduces edemas, it regenerates the tissues, and then it lessens the inflammation.
Right.
So,
Does that also take away some of the acidity in the system, do you know?
oh, yeah.
And makes it more, changes the pH of the system to a healthier level, so it's not as highly acid and it's more alkaline.
Right.
Okay.
And this is very crucial. This is a very important point.
Okay.
Because all our cells have a negative ion charge, and that's what keeps our pH at that alkaline level. All toxins carry a positive charge. So when your pH is the normal alkaline pH, those healthy cells have the ability to take any toxins and punch them.
Kill them.
Kill them.
Okay.
You know. So that's a very important point.
So when our body is overly acidic from all of the junk food and all of the toxins and the lack of exercise and stimulation of the getting rid of the congestion, then that means that our health in general is not good.
That's right.
Okay. All right. So you mentioned that without our lymphatic system, we would die in 24 hours?
Oh, yes.
A lot of us maybe don't know that. This is a system we want to protect.
Well, it's because of the blood proteins. See, all the nutrients that are going to that cell to sustain it for life, the hormones, the enzymes, everything that cell needs.
The fuel.
The fuel. And so that small little blood vessel that's carrying all those nutrients to that cell, then when those nutrients seep out, some of the blood plasma seeps out as well. And that blood plasma then becomes our clean lymph fluid after the dirty lymph fluid has been picked up and drained out of the system. So there's always a fresh, clean supply of, lymph fluid. Okay?
Okay.
But then also 50% of our blood proteins seep out every day. Those blood proteins absolutely must be picked up. And the circulatory system of the blood can't do it. Only the lymph vessels can.
Okay.
Now, the three main blood proteins, one of them is important for the clotting of our blood if we cut ourselves.
Sure.
That's the fibrinogen. And then we also have the globulins. Those are the blood proteins that are very significant to the immune system. And then the albumin is the largest of the blood proteins, but that protein creates a certain pressure gradient, so that so we have to have a greater pressure gradient on the inside of the blood vessel, and those have to be picked up, because if they're not, then the proteins will accumulate and clump together. All proteins are like water magnets. It'll attract and hold water. It will attract toxic debris. And if we lose that pressure, the proper pressure gradient from within the blood vessel to the outside of the blood vessel, the whole circulatory system can literally collapse.
Okay.
So I know.
It sounds okay. So tell me.
I know that.
Tell me how we keep that from happening. All right.
Okay.
How do we maintain this crucial system and keep it flowing, keep it moving, and prevent disease?
Okay. So we talked about the exercise, right, and muscle contraction, because this will act like a pump to keep the lymphatic system moving, and the deep breathing, and even bouncing on a rebounder or a trampoline, laying on a slant board, because
using gravity to move it. Okay.
Yeah. And then another one is to dry skin brush before you
I've
take
heard
a
about doing that, and I never really understood why. So explain why.
because
You take a dry, a soft brush, or
yeah, and you're
something,
always working towards the heart.
and you brush your skin before you shower.
Yeah.
Okay.
And but it stimulates the lymph drainage
Okay.
just under the skin.
Oh.
So those are some of the things we can do. And then when it comes to our diet should be at least 80% alkaline. So
And that means vegetables.
vegetables and greens, like
And greens.
and then also lemon is very cleansing to the lymphatic system, as is ginger. So you can have a ginger tea, you can add lemon to your water, and I mentioned the whey as being a
Whey
natural
protein.
diuretic, and you had mentioned the
Drinking 8 glasses of water a day at least. Trying
right.
to. And sometimes that's a challenge because you get busy, you forget, maybe you're not near a water fountain. What I try to do, especially when I was working in an office, is I'd have a water container on my desk with a glass. And I would fill it up, and then I would know how much water I had consumed during the day without having to make 8 trips to the faucet or even paying too much attention. So there are ways, if you find that you're not drinking enough, I always drink 1 or 2 cups of water when I get up in the morning, because that helps to hydrate you for the day. And then if I feel like I haven't been drinking enough during the day, I drink some before I go to bed, even though that might mean I have to get up in the middle of the night. I still feel that hydration is really crucial to health. So, so tricking yourself into remembering to drink water is one of the things that I recommend. Okay, and talked about food allergies impacting the lymphatic system.
Well, there again, whenever you create more toxic debris that needs to be processed, and food allergies is a signal,
An inflammatory response.
and something is,
Something is awry.
yeah,
Yeah, and the body has to deal with it
right.
and respond to it. So the more food allergies that you have that aren't addressed, then the more inflammation you will have, and you may or may not even be aware of it. So that also slows down your lymphatic system because it just has more to deal with.
Yeah,
Okay.
and as far as the allergies, to determine whether there is an issue with something like a genetically modified ingredient, or looking at the ingredients as far as what is in there. It may not be the food itself per se. I mean, I had a hard time finding a tuna fish that didn't have soy in it. I finally found one.
Oh, really?
But they put soy in everything. It's in everything.
Yeah, well, it's like corn syrup.
Yeah.
The ubiquitous,
Yep.
except most people think that soy is healthy. And in this country, it's not. And also, because it's genetically modified. And also, soy itself lowers thyroid function. So if you have low thyroid function to begin with, you certainly don't want to use soy as your primary source of protein.
Right.
So there's a lot of issues with soy.
Yeah.
One of the things we've got about another 15 minutes, so we've got some time here that I didn't put on this list of questions, but suddenly occurred to me that maybe you should explain it, is when people come to you for lymphatic drainage treatment, what should they expect?
Oh.
How do you treat?
Okay.
And I've experienced it, but I'd like you to
Okay.
explain it.
All right. Well, I do the electrolymphatic
Okay.
drainage, and manual lymphatic drainage is very effective.
And that's like a massage.
Yeah, but
Right.
it's
That's why you're a massage therapist. Yeah.
right. But with the electrolymphatic drainage, it creates a negative ion charge. Remember I said all the cells in our body have a healthy negative charge, and it repels the toxins.
Okay.
So with electrolymphatic therapy, the argon neon gases that are in the instrument create a negative ion charge that pulsates deep into the tissue. And it just feels like a warm, soft, soothing light on the skin. And it's also bringing oxygen into the tissue. And that's another thing Dr. Shields emphasized, is that when you get oxygen into the tissue, even damaged lymph vessels can bounce back. And anytime we have a significant fall or some other surgery will cut lymph vessels, but if you get oxygen into the tissue, then the lymph vessels can respond and rejuvenate. So with the electrolymphatic drainage, this negative ion charge gets down at the tissue level where the toxic debris is building up. And like I said, all toxins carry a positive charge.
Right.
Okay? So now what is happening is that negative ion charge, like it zaps, zzz, and it takes that clumping of the toxic debris and breaks it up.
So that it can drain.
So now
better.
the lymph vessels can draw it out of the tissues.
Okay. When I went to Bonnie, this device that she's describing, I can never remember the name of it, and so I always say it's like a hair dryer. It's about the size of a hair dryer, and you lay on the table. She has you. You can take off your major clothes, and you lay on a table under a sheet, and then she begins to run this device over your body from head to toe and back. And certain areas where, if there's an issue area, you would emphasize running this device. And I don't remember, does it touch the skin, or is it right?
Yes,
okay, it's on
absolutely.
the skin itself. I couldn't remember if you hover over it and just skim it, or if it
No,
touches
it touches
Okay,
the
so
skin.
that it goes, so that's how the argon gas and the
Neon gases
Neon.
that combine in the head of the instrument.
Okay.
But it's also bringing, like I said, the oxygen into the tissue.
Okay.
But this instrument works on all humoral tissue. Humoral means just all fluid tissue. So it even is effective for the circulation of our blood. And this is very helpful when blood glucose, diabetics with blood glucose elevated, because when you get too much sugar in the blood, the sugar molecule binds with our hemoglobin, and our hemoglobin is carrying the oxygen to get to the cell for the mitochondria and the ATP for that.
So it slows down the so that binding slows down the reception of oxygen and energy into the cells. Okay.
Right. And so the instrument will actually break up any of that clumping of the sugar molecules with the hemoglobin or the red blood cells.
Next time my sister visits me, she'll come to see you because she's a diabetic, and I think that would help her a lot.
Yeah, so it works on all of the fluids in the body. When people, let me just ask you a few other sort of arbitrary questions. When people have their lymph nodes cut out, say they have breast cancer and they've had to have the lymph nodes removed, how does that impact their immune system, their ability to detoxify through this system? Okay, so once you remove lymph nodes, you now have you have structural damage to the lymph system. This is the beginning of edemas. And
where the fluid builds up in a limb.
Yeah, because remember I said the blood plasma is seeping out along with the blood proteins to bring the clean fluid into the tissue. You can't turn that off. You'd be turning off your flow of your blood. You can't turn that off.
Okay.
So if the fluid can't get out of the lymph vessels and there's still more fluid coming in,
it's going to build up.
It's going to build up. So
Okay.
this is where decongestive physiotherapy and more significant lymphatic drainage treatments come into play.
Okay.
And most of the major hospitals around here do have lymphedema clinics now.
Okay.
And then the decongestive physiotherapy is a combination of specific lymphatic drainage techniques, but now the fluid has to be moved in areas where there are still healthy pathways, because it can't pass through where there are no lymph nodes.
Okay.
So
while it was seen and may still be seen, I'm not that familiar with it, as a life-saving technique to remove those, it actually creates permanent structural damage.
It's permanent, yeah.
Okay.
And then there are primary lymphodemas. There are children, that can be born with lack of lymph vessels in one of their legs or one of their arms. This is Milroy's disease, and they will have this for the rest of their lives.
Oh,
so people with significant lymphodemas, they really, really suffer.
They struggle too.
Oh, yeah. But
well, we've got about 10 minutes. So what I would like to do, you covered so much so quickly. Let's just give us a recap on the lymphatic drainage and what it does. Oh, and the other thing I was going to ask you is, after you treat me, the first time I went to you, I had what you warned me about, is that I might feel like I was coming down with the flu or having some significant immune challenges, because I had never had this lymphatic drainage done before. So it was an accumulation of a lifetime of lymph stuff built up and stored toxins and everything. And so you told me to drink a lot of water in the next 24 hours and just sort of not plan to do anything, just to lay low and pretend that it was the flu, but that it would be gone by the next day. So unfortunately, I had an appointment already made. And so I left your treatment session. I started to drive to the appointment, and I felt so ill. With you describing, I phoned and I canceled, and I went home and I went to bed. But I did follow your instructions, and it was totally fine the next day. But I think people should be aware that if they've never done this before, that there will be a huge detoxification that occurs.
oh yes.
And so to schedule their appointment, give themselves some little downtime after that 24 hours to sort of see how it's going to play out. Okay, so then back to give us a summary of lymphatic drainage and ABC.
Okay. Well, first of all, I think we should talk about there are some contraindications.
Things that you shouldn't do.
Well,
Okay.
no.
Or times when you shouldn't do this.
Just, right.
Okay.
Yeah, I think that's important.
Sure.
Because if a person has an infection with a fever, like if they have the flu or strep throat or something, whenever there's a fever, you don't want to do lymphatic drainage until that infectious phase is over, because you're wanting the pathogen to be in the node for as long as it needs to be to kill the pathogen. So and then go ahead. I'm sorry.
Well, basically, when your immune system is is challenged and dealing with something, you don't want to put it on overload if you don't have to.
That's right.
Right. So, okay, and then the next thing.
And then also some of the other contraindications would be if a person has decongestive heart issues, because lymphatic drainage is not going to be effective because their edema is not related to a compromise in the lymphatic system. Their edema is related to the fact that their heart isn't moving it.
The blood.
Yes.
Right.
And so they wouldn't benefit from that. Any phlebitis or thrombosis, lymphatic drainage must be avoided. But the indications aren't that many, but
they are very specific.
Yeah.
And so, so frequently, so I guess if you have major health issues, that you really should consult your physician.
Absolutely.
Before you do lymphatic drainage.
Yeah.
And not take it just as lightly as another detox system, but one that you really need to scope out. And then, are there any other things that you would tell people to expect afterwards that you didn't say to me because I didn't have any issues?
So when you're detoxing, quite often what can happen is that you might experience, more perspiration. I've had some clients that they woke up in the night and they were soaking wet.
Drenched.
Yeah, they were drenched. And you can have a stronger underarm body odor because you have those lymph nodes and the toxins are being processed.
Coming out through the skin.
Yeah.
Okay.
And then also your urine can have a darker color to it and a stronger odor. And that is just normal.
Okay.
Because
from the detoxing.
Okay. And then also the same with your elimination, because all of the 200 lymph nodes in your abdominal region dump the toxins right into the colon. So when you're doing lymphatic drainage, you're stimulating that. So people might notice that when they have an elimination, that it might have a stronger odor, but that's normal.
Okay, so none of these are things to worry about.
No.
So it's there are, as you detox, it comes out through the skin, through the organs of elimination. And so there again is why you should also drink a lot more fluid during that, especially during the time frame immediately following any lymphatic drainage.
Yeah.
And to dilute that and get it all out and comfortably. So is there a guideline about how often people should do lymphatic drainage?
I think it has to be on an individual basis. People like yourself that take care of yourself and you're active and you have an excellent diet. It might just be an occasional, like you referred to, a tune-up.
Yeah, once a year.
It's like some people, they go get their teeth cleaned twice a year or something.
Yeah.
But then there are other issues, and a biggie is fibrocystic breasts, because lymphatic drainage is phenomenal for helping fibrocystic breasts.
Oh, I didn't realize
So one of my clients, from the time she went into puberty, she was really suffering with painful fibrocystic breasts. And so sometimes she comes more frequently, but then now, as she's gotten into her postmenopausal years, she doesn't have the issue with fibrocystic breasts as much. So now she comes less frequently. If people travel to another country, and they drink the water or whatever, it's a good idea to do
lymphatic drainage when you come back.
Yeah.
Oh, that's
right.
Well, I had forgotten until you mentioned that. One of the reasons I came to you the first time was I had been traveling, and my ears had clogged up as the plane was descending, and they had stayed clogged for 2 months. And they cleared immediately when I did the lymphatic drainage with you.
And people with lymphedema issues, they have to be very careful with traveling by air. You know,
Should they get their lymphatic done before they go?
It wouldn't hurt, and then just to make sure, like they have compression stockings or whatever, because their ankles and their feet can swell. It's because, you know, you're up.
The elevation.
Right.
Yeah, right.
And then also when we were talking about, you know, infectious issues, but there are times like with when it's systemic, mononucleosis or Epstein-Barr or chronic fatigue. Because at those times, the body is producing so many white blood cells to fight the infection that the drainage at a cellular level is put on the back burner. And so now the drainage is slowing down.
At a time when it's
because the lymph nodes are working with trying to deal with this systemic infection. And so after the phase is over, it's always a good idea
to have lymphatic drainage and clear that system
out.
Great. Well, we are down to 1 minute. So this has been a great pleasure to see you again and to allow you to explain to our audience the importance of lymphatic drainage, which is your specialty. And so thank you for coming and sharing all of this information. I just really appreciate it.
Oh, I appreciate you.
Thank you.
Thank you.
And we are delighted. We appreciate you tuning in every Wednesday night at 7 o'clock for Restoring Health Holistically. And I hope that you will join us again next week for another interesting practitioner that can help you maintain your health and boost your immune system and enjoy your life more. Thanks and good night.